Welcome to Connective Care Education. Today we are going to look at Unit 001, the Principles and Values of Health and Social Care Adults. Unit 001, the Principles and Values of Health and Social Care Adults, Learning Outcome 1. Understanding how legislation, national policies and code of conduct and practice underpin health and social care and support for individuals. Introduction. Several key principles underpin health and social care services in Wales. These are: the individual is at the centre of everything we do. Services should be designed around their individual needs. Professionals should work together with the individual to meet their needs. The well-being and protection of the individual is paramount. Services must always promote diversity, independence, choice, empowerment, identity and safety. How legislation and national policies underpin health and social care and support for individuals. Legislation and codes of practice have been developed to ensure these principles underpin the way services are designed and delivered. This legislation and the codes tell workers how they should support individuals and how services should be planned, and they should underpin everything we do. There are several pieces of relevant legislation and codes to be looked at. The key piece of legislation is the Social Services and Wellbeing Act 2014. The Social Services and Wellbeing Wales Act 2014 changed the way local authority social services and other care services work together in partnership to help and support individuals. The Act helps ensure that individuals enjoy well-being in every area of their lives, as much as they choose and are able to. The Act brings together and modernises different pieces of existing social care law. This new legal framework consists of three elements: the Act, the regulations which provide greater detail about the requirements of the Act, and the codes of practice, which give practical guidance about how it should be implemented in social care settings. The Act applies to adults, individuals aged 18 or over, children, individuals under the age of 18, and carers, adults or children who provide care and support. The Act is made up of 11 parts. It consists of 5 principles and clearly identifies the individuals the Act affects. The principles or values of the Act are important as they impact on the way services are provided and how we work with and support individuals. Please watch the following video about the Social Services and Wellbeing Wales Act 2014. There is also a link provided. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 1, Principles and Values of the Social Services and Wellbeing Wales Act 2014. The Social Service and Wellbeing Wales Act 2014 is built on the following core principles. Voice and control, which means putting the individual and their needs at the very centre of their care and support so that they have voice and control over the outcomes that would help meet their needs. Prevention and early intervention involves encouraging individuals to ask for help or support when they need it, not when it may be too late. Wellbeing identifies how to support individuals to achieve well-being in every aspect of their lives. This involves all of the relevant services working together to support an individual's health and well-being, for example. Co-production is working with individuals, their family, carers and friends to identify and meet their support needs. The Social Services and Wellbeing Act and Advocacy. Individuals have full control when deciding the support they need, and in relation to making decisions about their care and support, they are viewed as an equal partner. Individuals can use an independent professional advocate to help them participate fully in the assessment, care and support planning, review and safeguarding process. Individuals also have a right to an independent professional advocate provided free of charge if they have difficulties in expressing their views, needs, wishes and preferences. As a carer, this impacts on your role as care must now be personalised to the individual through collaboration with them, which may involve support from an advocate. An advocate offers independent support to individuals who might not be heard, to ensure they are taken seriously and that their rights are respected. Advocates also help individuals to access and understand appropriate information and services. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 2, Putting into Practice the Act and Your Role. There are also numerous other pieces of legislation which are underpinned by the key principles and values mentioned earlier. We have the Human Rights Act 1998. This sets out the fundamental rights and freedoms that everyone in the UK is entitled to. The Act incorporates the rights set out in the European Convention on Human Rights into domestic British law. The UN Convention of the Rights of Persons with Disabilities is an international legal agreement which exists to protect and promote the human rights of disabled individuals. The UN Principles for Older Persons 1991 consists of 18 principles which can be grouped under 5 themes: independence, participation, care, self-fulfilment and dignity. Governments were encouraged to incorporate them into their national programmes whenever possible. Declaration of Rights of Older People in Wales 2014 sets out the rights of older individuals in Wales. The Mental Health Act 1989, Code of Practice for Wales 2008 and the Mental Health Wales Measure 2010 place legal duties on local health boards and local authorities about the assessment and treatment of mental health problems and ensures an individual's rights are upheld throughout access to services. The Mental Capacity Act 2005 and associated Code of Practice are designed to protect and give back power to vulnerable individuals who may lack capacity to make certain decisions because of the way their mental health is affected by illness or disability or the effects of drugs or alcohol. Deprivation of Liberty Safeguards, DOLS, are an amendment to the Mental Capacity Act 2005. They apply in England and Wales only. DOLS can only be used if the individual will be deprived of their liberty or freedom and rights in a care home or hospital. In other settings, the Court of Protection can authorise a deprivation of liberty. Care homes or hospitals must ask a local authority if they can deprive an individual of their liberty, and there are 6 assessments which have to be carried out before a standard authorisation can be given. The Welsh Language Act 1993, Welsh Language Measure 2011 and Mwy na Geiriau, More Than Words, give the Welsh language official status in Wales. They introduce standards to explain how organisations are expected to use the Welsh language, increase the use of the Welsh language, and make it easier for individuals to use it in their everyday lives. The Welsh Government Strategic Framework for the Welsh Language in Health and Social Care 2013 is the Welsh Government's commitment to strengthen Welsh language services to individuals accessing health and social care and their families. Please watch the following video on the Equality Act 2010. There is also a link available for you. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 3, the Equality Act 2010. The Principles of the Social Service and Wellbeing Wales Act 2014 putting into practice. It is important that timely advice and assistance is provided to individuals to prevent their situation from getting worse. Stepping in early to help individuals is crucial as it can reduce or delay the need for longer-term care and support. Let's look at this case study. Sean is 84 years old and lives on his own in a very rural part of Wales. His wife died 27 years ago and his daughter lives in Scotland. Sean has started to develop sight and hearing loss, so now needs help with all aspects of daily living. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 4, Putting Theory into Practice. Supporting practice. Individuals have full control when deciding the support they need, and in relation to making decisions about their care and support, they are viewed as an equal partner. Individuals can use an independent professional advocate to help them participate fully in the assessment, care and support planning, review and safeguarding processes. Individuals also have a right to an independent professional advocate provided free of charge if they have difficulties in expressing their views, needs, wishes and preferences. As a worker, this impacts on your role as a care and support must now be personalised to the individual through collaboration with them, which may involve support from an advocate. An advocate offers independent support to individuals who might not be heard to ensure they are taken seriously and that their rights are respected. Advocates also help individuals to access and understand appropriate information and services. Code of Conduct Professional Practice sets standards and guidance for all care professionals. In Wales, the Code of Practice for Social Care Employers, the Employers Code, sets the standards for employers. Practice guidance gives registered workers guidance related to their role. Other codes include the NHS Wales Code of Conduct for Healthcare Support Workers in Wales and the Code of Practice for NHS Wales employers, and practice guidance such as the Practice Guidance for Residential Childcare for workers registered with the Social Care Wales. Please visit the link below to look through the Code of Professional Practice for Social Care. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 5, Putting Theory into Practice. The Codes of Practice. These codes consist of a list of statements describing the standards of professional conduct and practice necessary for employees in health and social care professions in Wales. The codes play a key part in raising awareness of these standards. They are intended to be a guide for workers, individuals accessing services, and managers of services. In relation to individuals receiving care, the codes will make the individuals aware of how care workers should behave towards them, and also the role of employers in supporting care workers to do their jobs well. Employers of care workers are expected to promote the use of codes and take account of them in making any decisions about the conduct and practice of staff. The NHS Wales Code of Conduct for Healthcare Support Workers in Wales. The NHS Wales Code of Conduct for Healthcare Support Workers in Wales describes what is expected from healthcare support workers employed by NHS Wales in relation to the standards of conduct, behaviour and attitude expected when they are at work. The code applies to all healthcare support workers employed in clinical and non-clinical environments within the NHS and will be used to reference job descriptions. The code provides confidence and reassurance through a framework for public protection, incorporating the provision of guidance and support to healthcare support workers about their practice to ensure they understand what standards of conduct employers, colleagues, service users and the public expect them to follow. The code sets out standards so healthcare support workers can be sure what standards they are expected to meet. Healthcare support workers should use the code to assure themselves they are working to the standard, and if not, then change the way they are working. Healthcare support workers can use the code to review their practice and identify possible areas for personal development. The code supports healthcare support workers to fulfil the requirements for their role, behave in the correct way, and follow a duty of care and good practice. This is essential to protect service users, public, and others from harm and abuse. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 6, the Code of Professional Practice for Social Care Workers. There is a link at the bottom of the page. Practice Guidance. The Practice Guidance for Residential Childcare for Workers registered with Social Care Wales describes what it is expected of workers to support a high-quality service in relation to residential childcare. The guidance can also be used by employers to assess whether they have arrangements in place to ensure a professional and safe service is delivered at all times. The guidance covers child-centred care and support, good residential childcare practice, safeguarding individuals, health and safety, professional development, learning culture, and contributing to the development of others and contributing to the service, including raising concerns. The guidance builds on the Code of Professional Practice for Health and Social Care, and failure to follow the guidance could put a worker's registration at risk. Code of Conduct and Professional Practice for Health and Social Care and their impact on the principles and values of health and social care. Social care workers are responsible for making sure that they work to the standards in the Codes of Conduct and Professional Practice. Workers must ensure that their conduct and practice meet the standards and that no action or omission on their part harms the safety or well-being of individuals. The Codes of Conduct and Professional Practice provide a criteria to guide the workers' practice and gives clarity about the standards of conduct that they are expected to meet. Workers are encouraged to use this guidance to examine and reflect on their own conduct and practice to identify areas in which they can improve. Please pause the video here and complete worksheet Learning Outcome 1, Worksheet 7, Applying Code of Conduct and Professional Practice.